A very good evening, everyone, and welcome to episode 2 of the Clinic 2.0 grand finale, live clinical face off. If day 1 was about setting standard, today is about resilience, depth, and comeback. I am honored to introduce our mentor and host for today, Dr. Charan Aaditya Reddy, an MBBS graduate from Gandhi Medical College, Hyderabad, and currently a PGY1 resident in radiology at ESI Hospital, Hyderabad. Dr. Charan recently won the All India Clinic Case Carnival, presenting his own clinical case, a true reflection of his analytical strength and clinical insight. But beyond achievements lies a story of extraordinary grit. In his final year of MBBS, he met with a severe accident, spending nearly 1 year in hospital, a phase marked by trauma, uncertainty, and setbacks. Today, he stands back, driven by willpower, hard work, passion for medicine, and unbreakable mindset. This session today and this episode today isn't just about solving cases. It's about how learning, how clinicians rise, think, and never quit. Without wasting much of your time, can we have Dr. Charan? Over to you. Dr. Charan, over to you.
Am I audible?
Yes, yes.
Like, can you see my video? Like, is my
Yes,
video
yes,
on?
Dr. Charan, we are live,
Okay,
we are
sure,
audible.
sure. Hello, everyone. Like, that was a really sweet introduction, actually. And I'm really excited today for the grand finale of Clinic 2.0 quiz competition, actually. And on the hot seat today, we have Dr. Manthan, like from AIMS Rajkot. He's a third year medical student from the batch of 2K23. Now, I welcome Dr. Manthan. You can please join Dr. Manthan now.
Hello, am I audible?
Yeah, you're
Hello.
absolutely audible, and your video is not on.
Just
Yeah, it's on. It's on.
Yeah, it's on actually. And first of all, can you hear me, Dr. Manthan?
yes.
Yeah, first of all, a big congratulations to you. Like you like cleared your prelims round of this quiz among 37,000 participants actually. That's amazing actually, and you're now in the top 5 finalist list actually. Congratulations. So, tell us about yourself, Manthan. A small introduction. We are ready to hear you.
Uh, yes, sir. Sir, as you mentioned, myself Manthan Jikar from batch 2023, M. Rajkot. I'm basically from Junagadh, studying third year at AIMS Rajkot.
Okay. So, okay. And a fun question now for you, Manthan. So tell us about Dr. Manthan beyond the white coat, your hobbies, like things you're passionate about, and like some interesting facts about you. Who are you as a person beyond the
Sir,
white coat?
Sir, beyond the white coat, I very much like to read some fancy novels like the Harry Potter and many of those I have read recently. And I'm quite a peaceful person, quite introvert also, I would say,
Okay.
and also batch representative of my batch
Oh, that's great. That's
in AIMS
great to
Rajkot.
hear, actually. Anything interesting, like, should we know about you?
Not much, sir, to be
Okay,
honest.
what do you do apart from reading medical textbooks at home in your free time?
Sir, in my free time, I like to, read the current affairs. I very much like to read. I very much like to know everything what's going around in the globe. Also, I like to read novels apart from medical things like story novels and all.
That's amazing, actually. And how excited are you for the grand finale today?
So very much excited.
Okay, like you saw this coming already, like while you're participating in the prelims round. Did you expect you to be in the final round now?
Sir, actually no, because I when I saw the group, there were some what 40,000 students on that channel.
Exactly.
So I
Yeah,
thought, yeah, just try. Let's see what happens next.
exactly. So you believed in the process and not the result, right?
Yes, sir.
So are you ready for the final round? Let us go.
Yes, sir. Yes, sir.
Chalo, chalo. Chalo. Like I'll be telling you about a few points, and we have our computer G here on the screen on the other side of the screen actually. So he'll be giving us the slides and all. Okay.
Yes, sir.
Computer G, can you please can we like move forward? So yeah, I'll tell you about this event, Dr. Manthan now. So 15 questions in total, divided into three rounds. So three rounds. So round one is like a warm up round for you, a bit easy questions. That is like the name is the foundations first. And the second round will be clinical lens, where you'll be asking, like I'll be asking you some picture based medical questions in round two, 5 questions each. And then in round three, we have tougher questions in round three actually. That is the diagnostic edge. Like we'll be testing your medical skills thoroughly in this segment. Okay.
Yes, sir.
Next slide, computer G. And also you'll be having you can use three lifelines in this competition. So the first lifeline is the audience poll, where audience help will be taken and they'll be giving their opinion, their option actually. And the second lifeline is ask a friend. That is, you can like ask one of your friend and he'll be helping you with the answer. And then the third round is 50-50, where like computer G or computer G will be deleting two options and you can answer from the leftover two options actually. Okay,
Yes, sir.
you're okay with the rules, right? Okay,
Yes, sir.
so chalo, like I think we are good to go. Let's begin the event. You ready?
Yes, sir. I'm ready.
Okay, let's go. So coming to the first round, like I told you already, like five easy level questions. They're not really easy. You should be thinking like thoroughly. You should be using all your skills here. And like you'll be having 15,000 points in your pocket initially. That is 15,000 literal money. Okay. And for each
Yes,
wrong
sir.
answer, you lose 1,500 points in round one. Okay.
Yes, sir.
So
Got it.
15,000 points in total and minus 1,500 points for every wrong answer.
Yes, sir.
Chalo. Okay. I think computer ji, like I am ready, Dr. Manthan is ready. Let's start the event actually. So, Dr. Manthan, coming to the first question tonight, a 58-year-old man died 24 hours after the onset of substernal chest pain radiating to his left arm. On autopsy, an atheromatous plaque was seen obstructing the left anterior descending artery. Which type of calcification is most likely to be seen in this condition? So, in the options, we have option A, dystrophic with increased serum calcium. Option B, metastatic with increased serum calcium. Option C, we have dystrophic with normal serum calcium, and option D, metastatic with normal serum calcium. You can think and let us know the answer, Dr. Manthan. Sorry,
Please lock option C, option C, dystrophic with normal serum calcium.
you're
Dystrophic and
actually
normal
very
serum.
fast. Are you sure with the answer? I'm giving you one
Yes,
more
sir.
option now. So C is your
Uh,
option, right?
yes, sir. Dystrophic normal serum calcium.
Okay, computer G, please lock option C. Amazing, Manthan. So you got it right. So the answer is option C, that is dystrophic with normal serum calcium. Like, how did you arrive at the answer? Can you please know? The audience are excited as well.
Sir, because the atheromatous plaque, there would be some necrotic area and the debris would be present. So there would be dystrophic calcification, which occurs in the dead tissues mostly. And also in the dystrophic calcification, the calcium level is normal. It increases in metastatic calcium deposition only, not in the dystrophic one.
Absolutely amazing, actually. So, like, what like I use in my medical, matlab in my MBBS is D for D. Dystrophic is for dead. So, and yeah, the calcium metabolism is absolutely normal in case of dystrophic calcification, but it is deranged in case of metastatic calcification. You can see the table on the screen now. This is for all the audience actually. And also, audience, like, please grab a pen and paper. This is not just for Manthan, actually. Imagine you're all sitting on virtual hot seats, actually. And also, we'll be discussing many high yield and PYQs, which will be helpful for your NEET PG and 9ICT as well. Okay. And you don't have to worry, Dr. Manthan. You have to be using 100% of your neurons here in this quiz, actually. I'll be sending you the annotated important notes list personally. I'll DM you that. You don't have to worry.
Yes, sir.
So let's move on to the next question now. You ready?
Yes, sir.
Chalo, computer G question 2 for us now. So question 2 is, which of the following is not a risk factor for breast cancer? Option A is dense breast, option B is postmenopausal obesity, option C is early menarche, and option D is early pregnancy. Please let us know the answer, Dr. Manthan. Think thoroughly. You can take some time.
Sir, I would like to go with option D, early pregnancy.
Okay, I'll be giving you another chance. Please think again before locking the answer. Which of the following is not risk
Mm,
factor for breast cancer? Which of the following is not?
yes, sir.
You can also use any three of your lifelines as well
No,
if you're
sir, I
not
would like to
really
go
sure.
with early pregnancy.
Chalo, computer G, lock option D. Amazing work again, actually, Dr. Manthan. Like, am I confusing you, asking you for the second time if you're sure or not?
No, sir, it's fine. I am thinking again
But
also if you are
but it's
asking.
great actually. No matter what, even if I'm trying to confuse you, even if I'm trying to trick you, you're like very solid with your answer. That's absolutely correct. Early pregnancy is the correct answer. How did you arrive at the answer, Dr. Manthan? Please let us know.
Sir, I was confused between yeah, like postmenopausal obesity and this option, but then I thought postmenopausal obesity thoroughly, I mean, surely a risk factor for endometrial cancer, but I thought it secretes estrogen, so it should be hyperestrogenic state should be a risk factor for breast cancer also, like ER positive.
Yeah.
So I
Like,
thought early pregnancy was, I never read that early pregnancy is a risk factor for breast cancer. So.
okay, so like you already told, like regarding the breast cancer, like the first most important point is more is the estrogen, more is the chance of a female getting breast cancer. Actually, that is the basic rule. So what all causes increased in estrogen levels will definitely lead to increased risk of breast cancer, right? Okay, so like here, like there's already points here, like obviously that the sex is like that is obviously common in females, and more is the age, more is the estrogen exposure, and more the risk of breast cancer, and obviously family history of breast cancer is again a risk factor. We also have the most important genes actually BRCA1 and BRCA2. Can you please tell us any points about BRCA1 and 2, like from your side?
Sir, BRCA1 and BRCA2, which are two tumor suppressor genes. The mutation of them presents in many cancers, like also in the serous type of endometrial cancer, also in some types of like serous cyst adenocarcinoma of ovary, also in the
Exactly.
breast cancer, luminal type B, and medullary cancer, BRCA2 and BRCA1.
Amazing, amazing. You're actually, we can clearly see how, the best minds of India, think actually. Like you're very precise with your points actually. And also, like I already told you, it's not just about Manthan sitting on the hot seat. And every one of you, like audience, you're all sitting on a virtual hot seat as well. And now I'll be shooting a question to the audience. Like on the screen, we have Lee-Fromini syndrome. Which gene is involved in this condition? Computer G, you can open the chat box now so that I can see the audience answer now. The question is, which gene is involved in Lee-Fromini syndrome? Oh my God, I can already see the answers. Exactly. The gene is P53. And the next question for the audience is, sorry, Mantal, like let us also make sure, the audience are also participating. Okay. Okay. So
Yes, sir.
yeah, yeah, sure. Yeah, okay. So which chromosome is involved in Cowden syndrome? Question to the audience again. Exactly. So, like, I used to remember this like P10 chromosome for Cowden, like rhyming words, P10 for Cowden. And Peutz-Jeghers syndrome is a really important question. Like, Manthan, can you please talk something about Peutz-Jeghers syndrome, or let us allow the audience to talk about, like, answer? I want you to, like, it'll be great if you can talk about Peutz-Jeghers syndrome.
Sir, Peutz-Jeghers syndrome, it involves the STK11 gene on chromosome 19, which involves multiple
Okay.
colonic polyps and also involves mucocutaneous hyperpigmentation at buccal area and the anal orifice area, and also associated with many type of other cancers.
Amazing, amazing. I think you'll be taking 15,000 rupees home today. Like, you're so accurate, so precise with your explanations also. Amazing work. And yeah, are you ready for the third question, Dr. Manthan?
Yes, sir.
Chalo, computer ji, third question for us, please. So the third question is the letrozole, a competitive inhibitor of the enzyme aromatase, is prescribed to a patient with breast cancer. Which of the following is true about this type of antagonism? Option A is antagonism cannot be completely reversed by increasing the dose of the agonist. Option B, agonist and antagonist bind to the same receptor. Option C, an agonist cannot displace an antagonist from the receptor. And option D is a dose response curve shifts to the left side in the presence of an antagonist.
Sir, log the option B, agonist and antagonist bind to the same receptor.
Oh my God, you're like the way you're answering is faster than speed of light, actually. That's amazing, actually. So your answer is?
Option B, agonist and antagonist bind to the same receptor.
Let me not, confuse you this time. I'll go with your option. So computer G, option B, lock it. So yeah, like I already saw this coming. You're answering every question correct with so much precision, actually. Can you please describe how could you answer this question, Dr. Mantar?
Sir, so the basically letrozole, second generation is estrogen receptor blocker. So it's a competitive inhibitor, so which binds to the same type of receptor. If we increase the concentration of estrogen, the effect can be reversed. Also, the curve shifts to the right and not to the left because the K value of for the graph increases, uh, and it is a reversible type of antagonism basically.
Exactly, very correct actually. So, like, yeah, coming to like the difference between competitive and non-competitive inhibition. In case of competitive inhibition, the antagonist binds to the same site of the agonist, right?
Sorry, sir.
Like in case of
You
competitive antagonism, the antagonist binds to the same site as that of the agonist, right?
yes, sir. Yes.
So what happens to to this reaction if we increase the substrate concentration, if we increase the agonist concentration?
Sir, the effect reverses. The antagonist effect reverses.
Yeah, what is the effect of antagonist on like the velocity of the reaction in case of competitive inhibition? Is it
Sir, the maximum velocity remains the same.
exactly? There's no change in the Vmax. And what about Km and Vmax in case of non-competitive inhibition?
Sir, in case of non-competitive inhibition, Km remains the same because the affinity is same, but the Vmax decreases.
Crazy man, crazy. And open the chat box, computer G for us. Let us see if the audience are all alert and not sleeping like in the back benches. Like, are you all following audience? Actually, please open the chat box. Yes, yes, chalo. Yeah, Dr. Manthan, let's move on to the next question. You ready?
Yes, sir.
So yeah, computer G, next question, please. Okay, so a 24-year-old with a schizophrenia has not responded to adequate treatment with two different antipsychotics. Which of the following would be the drug of choice for this condition? Option A is clozapine, option B olanzapine, option C risperidone, and option D paliperidone. What do you think is the answer, Dr. Manthan?
Just a minute, sir.
Sure, sure, take your time.
Sir, I would like to go with option D, paliperidone.
Okay, let me confuse you now. So you sure?
Yes, sir. I think I would go with paliperidone.
I'll give you one last chance. Please think about it. Sure?
Yes, sir. I think
Hello, computer G. Option D, right?
yes.
So, computer G, please lock option D for Manthan. Okay, it's okay, it's okay. Don't worry, it's okay. Just one question, and it's fine. One question can't decide your finale today, actually. The answer is the option A, Manthan. It's clozapine. So, it is the drug of choice for treatment resistant schizophrenia, actually.
Yes, sir.
Okay, so it's fine, and also in the name itself, clozapine. The thing is, you should be observing for the side effects closely in case of clozapine. Okay, so
Yes.
there are many side effects, and like the most important side effects are agranulocytosis. The other is myocarditis, and the other is you can also see some metabolic complications in this case as well, right?
Yes, sir.
It's okay, like you at least like I'm happy actually, so that we're able to make you go wrong with one question because you're answering every question absolutely fine with so much of precision and accuracy. Okay, let's move on to the next question now.
Yes.
Sure, computer G, next question please. Okay, so which of the following factors does not affect the toxin production of corynebacterium diphtheria? Option A is concentration of iron in the medium. Option B is tox phage. Option C is biotype. And option D is concentration of zinc in the medium. Don't worry like about the previous question. Like please think and like give us your answer. Which of the following does not affect
Uh,
toxin production?
Sir, I would like to take phone a friend lifeline.
Chalo, now Dr. Manthan wants to use his lifeline, that is phone a friend, right?
Yes, sir.
Chalo, computer G, please allow Dr. Manthan to use this lifeline. Manthan wants to know his friend's opinion about this question.
Hi, Manthan. Can you hear me?
Yes, Rohit.
Okay, so the question is, which of the following does not affect the toxin production of Corynebacterium diphtheria? So concentration of iron in the medium would definitely affect it. Toxphage codes it, so that would also affect it. Now, the only confusion rests between biotypes and concentration of zinc in the media. Uh, I would like to go with
Option C or option D,
biotype.
Mr. Rohit? Which one?
I'll go with option C, biotype.
Sure.
Yes.
Dr. Manthan, are you sure with option C?
Yes, sir. I would like to go with Rohit.
So you trust Rohit a lot, I guess.
Yes, sir.
Chalo, computer G, both of Dr. Manthan and Mr. Rohit is like they want to lock option C. Please lock option C, computer G. Oops. It's fine. So the answer is concentration of zinc in the medium. So, like, concentration of iron is definitely needed. Some minimal amount of iron is definitely needed. But above that, even iron is not, good for the medium actually. And also biotype and, phage type is also important actually because this reaction is bacteriophage mediated, right? You okay, Manthan?
Yeah. Yes, yes, sir.
Okay, so in the first round, like out of 5 questions, you got 3 questions right. All the first 3 questions right in an absolutely amazing way, and 2 questions went wrong. It's fine. So yeah, okay. How many points? Let me please check, Dr. Manthan. So after round one, you have 12,000 points in your bag. That is 12,000 rupees in the purse, actually. What do you feel about round one? Is it really easy, like we told, or the questions are tricky?
Sir, the last two questions were tricky. First three, I mean, I knew the answer, so it was easy for me. Maybe I skipped somewhere these things. Uh,
Yeah, credits to you actually. I can see, matlab, I can clearly see why you're in the top five because the way you're explaining, like for all the questions was great actually. So next is round two. Are you ready?
yes, sir.
Or you want some time to, take a deep breath?
No, no, sir, I'm ready.
Sure, sure. So the round two is the clinical lens. So you'll be given image-based questions, okay? So like I
Yes,
already
sir.
told you, the rules are five moderate to like medium level image-based questions. So like and also 5 questions in this round, and for each wrong answer, you lose 1,000 points. It
Yes,
was
sir.
1,500 points in the first round, but here like we are saving some money for you. It's minus 1,000 points in the second round. Okay,
Yes, sir. Yes, sir.
so let's begin round two. You
Yes, sir.
ready? Chalo,
Yes, sir.
computer ji. Yeah. So the question is the first question of round two is you received a stool sample of a patient suspected to have dysentery in the microbiology lab. On microscopy, you observe the structures shown in the image. What other findings will you expect to see in his stool sample? The diagram is given on the screen, Dr. Manthan. You can see that, right?
Sir, I would like to go with
Wait, wait.
option
Let,
B.
let, let, me- let, me- let me at least tell you the options for the audience also. Yeah, so like I clearly know you're always ready with the answer as soon as I'm done with the question. It's great. Option A is RBCs as a discrete or in the Lorlex. Option B is charcot-laden crystals. Option C is abundant cellular exudates, and option D is absence eosinophils. Yeah, what's your answer, Dr. Manthan?
Sir, charcoal lead crystals, option B.
Sure,
Yes, sir. Go with option B.
absolutely,
Lock it.
absolutely. Chalo, computer G, lock option B for Dr. Manthan. Yeah, yeah. So, like, I mean, tell us about this question. Like, what is the organism? What is the clinical diagnosis? What is happening in the patient from
Sir,
your side?
the diagnosis was amoebic dysentery.
Okay,
So
the
the charcot
phenomenon.
lead sir, the charcot lead crystals are basically the degraded products of eosinophil, I guess. Uh,
Okay,
when there is any worm infestation or parasite infestation, there is rise in the eosinophil counts. So the degradation products of eosinophil would obviously increase in the stool.
okay, okay. And also, computer G, I don't think we need your explanation answer slides because Manthan is ready with all the explanation with so much accuracy. So, yeah. And a question for Dr. Manthan and the audience as well. The audience, are you ready? Please open the chat box, computer G. So, where else do you see charcot-laden crystals? The question is for the audience. I'm expecting two conditions where charcot-laden crystals are seen. Yeah, I can see asthma. Yes. Yeah, yeah, absolutely. The second condition is the ascariasis. Yeah. So yeah, charcot-laden crystals are seen in both allergic asthma and also in case of ascariasis. Amazing, amazing work, audience. I think no one is sleeping and you're all alert and active, along with Manthan who's sitting on the hot seat. Chalo, Manthan, let's move on to the next question, if you're okay.
Yes, sir.
Chalo. Okay, computer G, next question, please. Okay, in which of the following, which of the following organisms will the following phenomenon not be observed? Option A is Bacillus anthracis. Option B, Klebsiella pneumoniae. Option C, Neisseria gonorrhea. And option D is Haemophilus influenza. Not observed, the question says.
Sir, Neisseria gonorrhoeae, option C.
So you think this phenomenon is not shown by Neisseria gonorrhea, right?
Yes.
Chalo, I'll not confuse you for this question. Computer G, option C, lock. Chalo, I don't think we don't need this explanation slide. We are all waiting for your explanation, Dr. Manthan. Go ahead. Why
Sir,
is it
it
option
was a
C?
demonstration of capsule, the Quelang reaction. So
Okay.
basically, the Haemophilus influenzae is also capsulated. Other two options, Klebsiella is also capsulated. In the
Okay.
Neisseria, the meningococcus, Neisseria meningitidis is capsulated, and gonorrhea, Neisseria gonorrhea is non-capsulated, which is a basic difference between these two species.
So we all know this is an absolutely memory-based question. How could you remember this and answer this question right? Can you please know? The audience, they're all waiting for you as well. Your insights about this question.
Sir,
How could you?
like Sir, I remembered like when we do the splenectomy, we give the vaccines for capsulated organisms. So meningococcus, pneumococcus, these two are vaccines which are asked many times. So meningococcus is capsulated, and
Okay.
the gonorrhea is non-capsulated. That way, I remember.
Okay, you gave me an extra question for the audience actually. Amazing, amazing explanation. Audience, are you ready? Next question for you is which of the following is like the very first complication we usually see in patients who undergo splenectomy? The chat is open. Okay, let me reframe, let me repeat my question actually. So, which is the first step to be done in patients who undergo splenectomy? A precautionary measure, I'm asking you. Yeah. Yamini Chaudhary, correct answer, vaccination. Drashti, correct answer, vaccination. Yeah, Wasima, correct answer, vaccination. Yeah. So, like we usually, ask the patient to undergo vaccination for all the capsulated organisms because, like, that is a high risk factor in case of splenectomy. So, yeah, amazing work again, Dr. Manthan. Are you ready for the next question?
Yes, sir.
Chalo, computer G, next question in round three. Okay, so a patient on antiretroviral therapy comes for a regular follow-up, and you notice a nail changes as shown below. Which of the following drugs causes this condition? Option A is zidovudine, option B abacavir, option C is ritonavir, and option D diadenosine. Like the diagram, like the photo is on the screen for you.
Yes.
Take your time, don't worry. So basically, which of the following drug causes this condition as shown in the image? You
Sir,
can
I
use
would
a
like to
lifeline
go.
actually if you're not.
Sir, I would like to go with zidovudine.
So option A, you think.
Uh,
Are
yes,
you
sir.
sure, or would you like to use the remaining two lifelines? Two lifelines are ready for you. They're waiting for you to
Sir, I
use them
think,
actually.
I'm not very sure, but I think my
Okay.
instinct says it should be zidovudine. I have some logic behind it. So I think
Got it,
it
got
should
it.
be.
So, like, I'll be locking option A for you. Sure.
Yeah. Yes, go
Chalo,
with option.
computer G. Dr. Manthan says option A. Lock it. Oh my God! This is a take-home point for the audience and for all of us actually. It's always okay to trust your gut sometimes, not always your brain. And also like studies say instincts are usually correct. So yeah, amazing work again, Dr. Mantha. The correct answer is option A, zidovudine. How did like you're not initially sure about zidovudine, right? You're not really sure about the answer, but how could you confirm option A as the correct
Uh,
answer?
uh, Sir, I knew that zidovudine causes anemia, and anemia generally causes nail changes and knuckle pigmentation. Nail changes are very common findings in anemia. So I thought this should be zidovudine because it characteristically causes bone marrow suppression and aplastic anemia.
Crazy, crazy, Mr. Manthan. So for the audience, actually, you can note this down. Like this is a really important drug, zidovudine. So like they'll be asking us about questions on the adverse effects of zidovudine. So the top, like again, the top three like highly important adverse effects are nail hyperpigmentation, just like how Manthan told us already, and myopathy is another adverse effect, and bone marrow suppression is like the other adverse effect. Crazy, crazy work, Manthan. And I think we should be telling Computer G to not show any explanation from now on. You're already ready with all the explanations, absolutely, like with so much of precision. Congratulations, crazy work. So, let's move on to the next question if you're ready.
Yes, sir.
Done, done. Crazy. Computer G, next question, please. Okay. So, a patient presented with severe headache and transient loss of consciousness. Uh, uh, 1 second, the question is not clear for me. Okay. So, a patient presented with a severe headache and a loss of consciousness. On examination, neck rigidity was present and blood pressure was 160 by 110. And a CT brain was done and is shown below. Which type of aneurysm could have been involved in this condition? Option A, fusiform. Option B, saccular. Option C, false aneurysm. And option D, dissecting aneurysm.
Mm,
The diagram is shown on the screen.
yes. Sir, I think I would go with secular aneurysms. It's a berry aneurysm, basically. I think it should
So
be
you say
secular.
saccular aneurysm is the correct answer.
Yes, sir. Lock
Chalo.
secular.
Chalo, Computer G, please lock option B, saccular aneurysms for us. Amazing work again. I think I'm short on compliments for you because you're doing great job today tonight actually. So the correct answer is saccular aneurysms, and me being a radiology resident, like I really want to talk say a few points about this. I think Dr. Manthan is a better person to talk about this because his explanations are very clear, very precise. So yeah, tell us about this thing, Dr. Manthan. We are waiting for your answer, for your explanation
Uh,
actually.
Sir, basically, it was a berry aneurysm, which was very evidently seen in the radiograph. In the circle of Willis, there is an aneurysm. And sir, by the shape, from the image, I thought it was not looking like fusiform. So
Wait.
basically, I had confusion.
Sorry to interrupt you, Dr. Manthan. Let us first ask our audience a few questions because we all know you're ready with your explanation, like better than Marrow's explanation. So let us give our audience a chance. You're okay with that?
Yes, sir.
Sure. Let us ask them a few questions and then you can explain about the condition. So the question is for the audience actually. The chat box is open. Computer G, please open the chat box. So, what is the difference between a true aneurysm and a false aneurysm? You can type your answers in short. It's fine. Difference between a true aneurysm and a false aneurysm. Sharon says all layers are involved. Okay, Lokesh is ready with the answer. Kavya, all layers are not included in case of false aneurysm. Crazy. Yeah, true involves all the layers of the blood vessels. Yes, yes. So in case of true aneurysm, all the three layers of the blood vessel are involved, and in case of false aneurysm, only two layers are usually involved. And the next question is what are all the three layers of a blood vessel? A basic but a really important question. So the question is what are the three layers of artery? Okay, wait, Vaishnavi. Sharon is again ready with the answer. Yeah, crazy, crazy. So yeah, like the three layers are intima, media, and adventitia. Adventitia being the outermost layer, and intima being the innermost layer. And Dr. Manthan, a question for you in between. So the radiograph is shown on the screen. What is it? Like, is it a CT? Is it an MRI or an ultrasound? What do you think? Or is it an X-ray?
Sir, it's looking like a city, but I'm not sure. I don't have that
Yes.
much exposure with radiology, but I think
It's fine. It's fine. So let me tell you. So the thing is, the physics behind a CT scan is X-rays, right? That is many X-rays, like cutting the body, right? Many sections of the body. So, how does a bone appear on an X-ray? You say?
sir, radio opaque.
Yeah, it is hyper intense, right? It is
Yes,
opaque.
sir.
It is white in basic terms. So here you can see a skull in white color that is hyper intense, right?
Yes, sir.
So yeah, like the physics is like this particular radiograph is following X-ray physics, right?
Yes, sir.
So I think we can call it a CT scan.
Yes.
Yeah, on MRI, the bone is usually hypointense, that is dark. On MRI, the bone is the skull is usually dark. And question for you, like this is a tough question, and where is the aneurysm located in this case?
Sir, this is the aneurysm in the
What is the
circle
type
of
of hemorrhage
Willis.
here?
Sir, the type of hemorrhage is subarachnoid hemorrhage, I think, because it's
Crazy.
diffuse.
Crazy, crazy. Yeah. So the three types of hemorrhages in brain are like epidural, subdural, and this is the subarachnoid hemorrhage. Absolutely correct. Like we can see a star-shaped hemorrhage in this radiograph. So we can like the appearance, it is a star shape. So we can call it subarachnoid hemorrhage. And audience are already ready with the answer for my next question. So the most common site of aneurysm in case of a subarachnoid hemorrhage, which artery is usually involved. Like Matthew is ready, hurry, anterior communicating artery. Crazy, crazy work by the audience as well. I think both like the finalist and the audience are doing a great job today. I think I'm doing a good job as well. Let me take some credits also. So yeah, what is the shape of the bleed in case of epidural hemorrhage? Question to the audience. The shape of hemorrhage on the radiograph in case of epidural. Okay, it's the biconvex lens shaped. In case of subdural, again, question to the audience. Computer G, I think you should be keeping the chat box open in this session because audience are really active and ready with their answers. Chalo, like it's concave or convex. Yeah, correct. Chalo, Manthan, let's move on to the next question. Are you ready?
Yes, sir.
Or am I making you wait, asking the audience so many questions?
No, 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 sir. It's fine.
Yeah, sure. I think it will be like a revision for your exams also.
Yes, sir.
Sure, sure. Okay, next question. Computer Ji, next question, please. Okay, a 47-year-old man comes to you with a progressive heartburn and difficulty swallowing. She, old woman actually, she also describes episodes of painful blanching and bluish discoloration of her fingers and toes on exposure to cold. The following findings are noted on examination. Antibodies to which of the following are most likely to be seen in this patient? The picture is on the screen. Option A is the antibodies against the ribonucleoproteins. Option B is matlab histidyl tRNAs, that is antibodies. Option C is antibodies against histone proteins, and option D is antibodies against centromeric proteins. Up to you, Dr. Manthan.
Sir, I would like to take audience poll.
Okay, so you're left with two lifelines, and you like to use one of your lifelines, that is audience poll, right?
Yes,
Chalo,
sir.
computer G, Dr. Manthan wants to use his lifeline, that is audience poll. Can you please let audience poll like on the screen? like like the poll is on the screen, audience. You can choose your option, your answer. Okay, audience, you can actually post your answer. You can select any option, option A, B, C, or D. And please help Manthan. Please don't teach him this time. Selecting the wrong options wantedly. I hope you'll not do that. Okay, we're closing the audience poll window on the screen now. Chalo. Oh, yeah. So like the results are out. So option A, 8% people chose the option A, 41% for option B, 12% for option C, and 40% for option D. Very close between option B and D. So Manthan, what do you think? Option B is 41%, option D is 40%. Tricky audience today, like I already told you. Option B,
Sir,
41%.
I would like to go with histidility RNA synthesis.
Option B,
B,
right?
yes, sir.
Computer G, can you please like close this window, audience poll window? Okay, yeah. So what do you think, Dr. Manthan?
Sir, B, I think.
Because
Histidility RNA.
41 people,
Uh,
41% of them feels option B is correct, right?
Sir, basically, I have no idea for this question, so
Okay,
let's see.
let's go with the audience you feel.
Yes, sir.
Chalo, Computer G, log option B for Manthan. Let's see how accurate our audience are. Okay. They ditched you, Manthan. So the correct answer is option D, that is antibodies against the centromeric proteins. Like after reading the question, like could you understand what the scenario is, what the diagnosis is?
Sir, it was some kind of autoimmune. That much I got,
Okay,
and it was
okay,
showing on the skin. But
okay.
I couldn't recall which syndrome was that. So I have no idea for what antibodies this
Got it,
had.
got it. No problem actually. So, like the question is about the CREST syndrome, which is an autoimmune condition. So, CREST, like the mnemonic is a CREST, where this syndrome has five components. Like, audience, you're all following the session, right? Please make note of important points. They're really useful. The questions are amazing actually from like our computer G is giving us really important questions for NICT and NEET PG. Uh, Chat, please open the chat box and let me know if the audience are following the session, if they're noting down all the important points from this session. Okay, Ashwika, yes. Vaishnavi, yes, sure. Okay, done. So CREST syndrome includes five components, Dr. Manthan, basically. So it's C for calcinosis, R for Raynaud's phenomenon, and E for esophageal dysmotility, S for sclerodactyly, and T for telangiectasia. Chalo, let's move on to the next question if you're okay.
Yes, sir.
Done. Computer G, next question, please. Okay, sorry, like we're done with the round two actually. You did an amazing job, and yeah, your opinion of round three was how was the questions? How was
Sir,
round
yeah, this
two?
round was better than round one for me, I guess.
What do you mean? What do you mean?
No, sir, the questions were quite like challenging, but yeah, I enjoyed the round because it was quite logical than round one. More logic than memory, I think, for me.
True. Like
So
less of
I
memory-based questions this time, yeah. And I like to say this, like as the going gets tough, the tough gets going. A classic "Kaun Banega Crorepati," dialogue actually. Yeah. So round two, like question one was correct, question two correct, question three correct, question four correct, and question five was wrong. And like, are you calculating how many money is left in your purse? Actually, can
sir,
we know?
11K as of now.
Oh my God. Like, how do you know, by the way?
Sir, two questions wrong in round one, it gets
Okay.
1500, so makes 3000 less, so 12,000 and 1,000 deducted in this round, so makes 11,000.
Smart, actually. So, yeah, after round two, you have 11,000 points in your bag. That is 11,000 rupees in your pocket now. And let's blame your friend for, taking away, 1,500 points from you. Okay, chalo. You ready for round three?
Yes, sir.
So this is gonna be okay. One second, computer G. One second. So So yeah, round three is gonna be the name is the diagnostic edge. So you'll be having critical, tough questions in this round. Five questions again. So yeah, rules please, computer G. So it consists of five hard questions, and like you have 11,000 points in your bag, right? And for every wrong answer, you lose 750 points this time. Okay. Chalo, let's.
Yes, sir.
Are you ready for round three?
Yes, sir. I'm ready.
How excited are you for round three? Because like computer G is clearly, showing us hard questions, five hard questions this time.
Let's see, sir. If I know, I know. If I don't know, it's hard. If I know, it's easy, I
Yeah,
think.
as simple as that. As simple as that. So computer G, first question of round three, please. So yeah, peripheral smear of a patient with acute promyelocytic leukemia shows myeloblast with the following finding. What are these made of? Option A is endoplasmic reticulum, option B ribosomes, option C lysosomes, and option D Golgi apparatus. What is it made up of? The shown like arrow mark is shown on the screen. Don't worry, take your time. Are you ready with your answer, Dr. Manthan?
Mm, just
Sure,
minutes.
sure.
Sir, I would like to go with endoplasmic reticulum A.
How sure are you? Out of
Sir,
10.
I have confusion between A and D, but yeah, I would like to go with A.
You have one more lifeline. Okay, okay. That is 50-50 again, actually. So,
Sir, it would make one more.
things more complex, actually.
Yes, sir.
So, yeah, option A, right, for you?
Yes, sir. Go ahead with it.
Hello, computer G, option A for Dr. Manthan. He's not sure, but let's go. Option A, lock.
Oh,
Oh, so sorry, Manthan. The correct answer is option C, lysosomes. So, like, could you able to recognize,
sir,
can you
sir,
please
I was
question again? Computer G, previous slide. Okay, like what is shown in the image exactly? The yellow arrow.
sir. This is these are all rods which are made up of procoagulant material. When
Okay.
the cell are destroyed, they causes DIC. But I thought these are proteins, so it should be related to ER or Golgi, I think.
Okay, which ER? Is it rough endoplasmic reticulum or smooth endoplasmic reticulum?
Rough endoplasmic reticulum.
Why? Why? Why is it so?
So because proteins are there, proteins are made
Yes.
in rough endoplasmic.
Exactly. Yeah. Rough endoplasmic reticulum is studded with ribosomes, which is the protein house of the cell. So next slide, computer G, like the answer slide. I have some questions for the audience now. Even though your answer was wrong, but your explanation was absolutely correct, Dr. Manthan. So these are our rods, and a group of our rods are called faggot cells. And a tough question for the audience. Are you ready? Please open the chat box, computer G. So like in which AML this is seen? Our rods are seen in which subtype of AML? Hari like is ready with the answer already. Which AML subtype? Kavya, is it M2 or M3? Be precise. M3, chalo, correct. So all rods are seen in AML subtype M3 actually. And like Dr. Manthan already told, the risk factor is DIC, like the patient is at risk of developing DIC. Manthan, can I ask you one tough question from the same concept? Are you ready?
Yes, sir.
Okay, so like what is the treatment for this thing, AML M3, if you
Uh,
know?
sir, all trans retinoic acid and arsenic oxide of arsenic.
Crazy man, how do you know this actually? I mean,
Sir, I read the treatment, I read the morphology and everything, but I
okay.
didn't know it is made up of
Yeah,
lysosomes.
you told me that the complication is DIC. Computer ji, I think we shouldn't be deducting any points for this question for Dr. Manthan because he's absolutely clear with his explanation. And what is the type of a translocation, if you can know, Manthan?
Sir, 15, 17, rungs 1, T1 translocation.
Crazy, 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 amazing. So yeah, okay, and all right, let's move on to the next question if you're okay.
Yes, sir.
Chalo, computer G, next question for this amazing junior doctor, Manthan. So yeah, a 4-year-old child presented with multiple episodes of vomiting and seizures since one day. She had fever, rhinorrhea, sore throat, and myalgia yesterday, for which her parents gave her some over-the-counter medications. Investigations reveal elevated serum transaminases, which of the following is the likely causative viral organism and the medication administered.
Sir, I think I would go with RSV and aspirin, option D.
Sorry, RSV and aspirin.
R, option D.
Sure,
Yes, sir.
100%.
I think so, sir. This should be right.
How sure are you on the scale of 10? 4 out of 10, 5 out of 10, 10 out of 10, 9 out of 10? What do you
Six
think?
or seven, I think. 6 or 7, I think.
Chalo, so you feel option D is correct, right?
Yes, sir.
Chalo, computer G, please log option D for Manthan.
Oh,
Sorry, Manthan. Like B is the correct answer. So it's influenza virus, and the OTC drug was aspirin.
sir, I
So
know it's Ree syndrome, but I thought RSV is very common for newborns and infants, so I
okay,
get with.
okay, okay. It's okay and it's fine. So the organism is the influenza virus, and the drug is aspirin. We usually talk about Ray's syndrome, right? Like like when an infant, a child, usually aspirin, which is an NSAID, is contraindicated, which is usually not advised, right?
Yes, sir.
Can you please throw some light on Ray's syndrome for us? Let us like I'll learn from you, and the audience are ready to learn something from you. Like, could you have any points about Ray's syndrome, about aspirin?
Sir, so basically it's a side effect of aspirin in infants. So after viral infection, if we give aspirin, it causes the hepatocyte injuries and releases the enzymes from the liver, the intracellular enzymes, AST, ALT, etc. And it should not be given in children with viral infection.
Okay. So in round three, like your first answer was wrong. Second question, didn't go well for you. So how many points? You please tell us. You're faster than computer G.
Sir, I guess 9,500.
Absolutely. So you're left with 9,500 rupees in your pocket actually, and I hope you'll take 9,500 home today without losing any more questions. So we have three questions left in round three, right?
Yes, sir.
You wanna take some time, take a deep breath, like relax, or let's go with the next question.
No, no, sir. Let's go ahead.
Chalo. So computer G, next question, please. So yeah, which of the following is both a diffusion and dilution method of testing antibiotic sensitivity? Option A, Kirby-Boer method. Option B, Epsilometer method. Option C, Stokes method. And option D, tube dilution method.
Sir, I would like to go with epsilometer, option B.
Sure.
Yes, sir.
Please think about this, Manthan, because I don't want you lose. I don't want you to lose any more money. I want you to take 9,500 home tonight.
No, sir, I think the option B should be correct.
You're
Epsilometer is
confident, right?
specifically.
You
Yes, sir.
sound confident actually. Chalo, computer G, please lock option B for us. Dr. Manthan is pretty confident about his answer. Option B, lock. Is everything okay, computer G?
Yeah, Dr.
I
Charan.
think,
Yeah, we are just.
sure. Yeah. Okay, there might be some network issue. It's fine. Like our computer G will be back. Can you hear me, Manthan?
Yes, sir, I can hear you.
Yeah. Crazy work tonight actually. Like inspiring work actually. Like because I already told you your explanations are much better than computer G. Like it's better if we take your help about the explanations from tomorrow. You please give us the explanations for next finale. uh, okay, so question three, like okay, we're waiting for computer G. Okay, audience, like how is Mr. Manthan performing tonight? What do you think? Okay, our computer G is back. Yes or no, computer G? Okay. So yeah, correct answer again. So the answer is option B, epsilometer method. Do you know about this, Manthan? Like I think this question is like a fact-based question. How could you answer this?
Sir, the basically, so epsilometer, it uses Muller-Hinton agar only, which is also used in Kirby-Bohr method. But it has a marking on its center, a scale for the MIC. We inoculate there is a bacterial colony, and the epsilometer is ready with the antibiotic. The amount of zone of inhibition in the millimeters is already converted into epsilometer to the MIC in the concentration units, and we can know the MIC of the antibiotic using the Muller-Hinton agar only. So it's both diffusion and tube dilation.
Okay. And can you throw some light on the classification, I mean, the types of antibiotic sensitivity testing, that is diffusion and dilution? What exactly
Sir,
happens in diffusion and what exactly happens in dilution?
In the diffusion method, we first of all we isolate the bacteria, then we inoculate the bacteria into Mueller-Hinton agar, and then we apply the antibiotic around the colonies. The amount of zone of inhibition formed around the colonies used by the Vernier calipers gives us the in terms of sensitive, resistant, or moderate in terms
Okay.
of that. And in
Yeah.
the tube dilation, we use the serial dilutions for the antibiotic and at which concentration the growth is inhibited, we see.
Sure, sure. And audience, I think Dr. Manthan is giving you so many important points to, note down actually. And a question for audience now, like very, a generalized question for you all. So, like, give me the names of, two or three very notorious bacteria, The chat is open now. The question is the two or three notorious bacteria, which is almost sensitive to all the antibiotics. Yes, Vaishnavi, Pseudomonas is like the like that will top the list. Staph aureus is not. MRSA, yes. Klebsiella, yes, Shrinika, correct answer. E. coli is not. Chalo, yeah, like the top two bacteria usually, like it is the Klebsiella. The top is obviously Pseudomonas. It's a superbug, yeah. And the other bacteria is a Klebsiella, correct. So, yeah. Shall we continue to the next question, Manthan?
Yes, sir.
Chalo, computer ji, next question for Manthan, please. Chalo, fourth question. This is the penultimate question of this, entire finale. Actually, Manthan, are you ready?
Yes, sir.
Yeah, an elderly patient with heart failure and atrial fibrillation is stabilized with the digoxin. By what mechanism does this control the arrhythmia in this patient? Vagolytic action, sympatholytic action, decreasing the atrial repolarization by blocking sodium channels. Option D is increasing the vagal tone.
Sir, I would like to go with increasing vagal tone, option D.
Sure.
Yes, sir.
You can actually think, because this is a classic, physiology pharmacology question. You should connect all the dots and arrive at the answer, right? So
Yes, sir. I have a clear logic, so it should be vagal tone.
yeah, like we already saw your speed, you're faster than light. So your option is D, right?
Yes, sir.
Chalo, computer ji, lock option D, increasing vagal tone for Manthan. Correct answer, crazy. So yeah, like digoxin is a really important drug for all the all the medical entrance exams, and like I want it's better if Manthan throw some light on this drug actually. Manthan, can you please tell us about this drug?
Sir, so the digoxin, it basically blocks the sodium potassium ATPase. So the sodium potassium ATPase is blocked. So it in turns blocks the sodium calcium channel, and it inhibits the efflux of calcium. So the calcium concentration inside the cell is increased, which stimulates the contraction. This is the one mechanism. Another mechanism being the increasing the vagal tone at AV node. So the atrial fibrillation, the impulses from the atria do not travel to the ventricle and do not produce fatal effects. The currents remain in the atria only, do not pass to the ventricles, and ventricles do not suffer.
Yes, yes, exactly. Absolutely correct, Manthan. And let us shoot a question for the audience now. So, what is the exact function of sodium potassium pump? Like, what does it do? How many potassium in or out? Like, sodium in or out, potassium in or out, and the number of ions. Yeah, it maintains the resting membrane potential. Number of ions in and in or out. You can, okay, three sodium out, two in, three sodium out, and two potassium in. Yeah, correct, correct, exactly. And yeah, like the audience are equally active and equally enthusiastic and equally correct now. So yeah, next question. Are you ready, Manthan?
Yes, sir.
Chalo, let's proceed to the next question. Computer G, next question. Yeah, this will be the last question tonight. So, a patient of chronic low back pain has presented to your OPD with deranged LFT reports. He tells you he has been on long-term treatment with a painkiller for his condition, which NSAID has most likely been he most likely been taking. Is it
Sir, I
diclofenac
think,
or sorry?
no, no, sir, please continue. Sorry.
Yeah. So, is it diclofenac or acetaminophen or piroxicam or indomethacin? You're already ready with your answer, I guess.
No, sir, I would use the lifeline which I have left with. I would use it.
Is it a smart strategy because you want to use a lifeline because it is available, or you're not sure about the answer?
No, sir, it's available. It will be wasted if I don't use.
Yeah, it's a smart move, I can say. Chalo. So, Computer G, Dr. Manthan wants to use his one last lifeline that is 50-50. Please delete two options for us. So, Computer G will be deleting two options for us, and two options will be left so that you can choose your answer from them. So, yeah, option A and option B are left. Option A is diclofenac, option B is acetaminophen.
Sir, I would like to go with acetaminophen.
Sure.
Yes, sir.
Chalo, this will be the last and final question. So let me talk to you about this condition, this question more actually. Why acetaminophen? Why not diclofenac?
Sir, acetaminophen, if used very much, like paracetamol, so it produces NABQI and acetylbenzoquinonamine, which damages the liver. So there is deranged LFT, which is a classical paracetamol toxicity symptom.
So you feel option B is correct, right?
Yes, sir. I think paracetamol should be considered.
Chalo. Computer G, for one last time, please lock option B for us.
Oh.
Oh, sorry, Manthan. It's option A. Diclofenac is the correct answer. So it's a basically an NSAID with highest risk of hepatotoxicity compared to acetaminophen actually. But we are
Yes, sir.
usually used to studying about acetaminophen in our UG days because like that is more important and we often see that question in the exams. But diclofenac is like it has got the highest risk of hepatotoxicity. So yeah, so as diclofenac is the correct answer. So yeah, like we are done with the round three as well. So yeah, it's better to ask you about how many points you're left with instead of asking computer G.
Mm,
You're more fast, you're more accurate.
8750, I guess.
Oh my God, crazy man, crazy, chalo. So yeah, the grand finale is over, and let's hope. Let's wait for Computer G to calculate your final score because he's not as fast as you. So yeah, Computer G, the session is over. Can you see the screen, Dr. Manthan?
Yes, sir.
So tonight you're taking home 8,750 rupees. It's not just about the cash. Like, you definitely, if you ask me, you deserve 15,000 rupees because you've done an amazing work, crazy, inspiring explanations, inspiring work. Like I already told you, your explanations are way better than computer G's explanation today, actually. So yeah, like you won 8,750 rupees of actual money, like not just points. Like, these are actual money.
Yes, sir.
So yeah, like the audience are excited that they're congratulating you. So how's the Josh, Dr. Manthan?
Hi, sir.
Okay. Like, yeah, like you should be winning 15,000 rupees, man, because crazy work from you. Audience are also very excited. Yeah, Manthan, very intelligent. NAPQI is in okay. Chalo, thank you for like, yeah, congratulations, Manthan. You can see like the audience reaction, right, Manthan?
Yes, sir.
You can read those comments, right?
Yes, sir. Yes.
Chalo, crazy work, man. Like, we're all happy to see you win 8,750, but I'm disappointed because I wanted you to take 15,000 rupees home tonight. And please don't, no, no, please don't, call your friend and, scold him because he, told you the wrong option today. And I think he should pay you 15,000 rupees because he's the reason because you lost 15,000 rupees because of him, I guess, tonight. Huh?
Yes, sir. No,
So
no,
what are you
it's
doing?
fine.
Huh?
No, no, sir, it's fine. I mean, sometimes it gets wrong and
Congratulations,
Chalo,
Dr.
chalo.
Manthan. Many, many congratulations. Really,
thank you,
really
sir.
happy and proud to see the way you played today. Today, I don't think it was a quiz, it wasn't a live show. It was nothing short of a master class. Dr. Aditya, kudos to you. What an amazing host. Matlab, the
You.
entire show was so engaging. The way Aditya and Manthan, that you guys, I thought you guys are in the same team, the way you guys are playing. I and actually it felt like Neat PG today. This is what happens in the real time, real life in Neat PG. Manthan absolutely knew all the concepts, all the topics. He is well read, right? But that's how the examiner confuses you. Two options very close. And that is where I think Manthan, you are a very right way, bro. I think the way by the time Neat PG comes, you will kill it. I think you will kill it. The way you played today, just keep solving MCQs. Your concepts, your foundation, your base is fantastic. An amazing. I'm just mesmerized by the masterclass today. I would not like it to call a quiz or a show. Kudos and congratulations, Dr. Manthan, and thank you, Dr. Aditya, for being such an amazing host. I hope the team gets you back once again to be our host. It was truly, I think, so engaging for me personally to learn so many concepts, to learn the art of solving MCQ, to eliminate the wrong answers, and not just that, understand from every topic how can different questions be formed. It was truly a masterclass. Thank you to both of you. Over to our host Satyam and Dr. Aditya.
And
Congratulations,
also,
Dr.
can I have something to say, Mr. Faisal?
Please, Dr. Aditya. The stage
Yeah,
is yours.
petition to add, Dr. Manthan into your team because his explanations are crazy and much better and very precise than Computer G's explanations actually after every question.
Absolutely,
Yeah,
absolutely. The
yeah,
way he explained, well, that was, we have heard this so many times. The power of the art of solving MCQ. We have
yeah.
seen people having a gold medalist understanding the concept so well, and that's where they miss. Ki the examiner tricks them with two answers which looks very similar, and that's where the art of solving MCQ comes in. I think it was a masterclass for all of us, and I truly accept, Aditya, what you say. I think Manthan's
Yeah.
concept explanations were spot on. Every wrong answer personally pained me. Truly, I genuinely wanted him to have 15 on 15 today, but that's how the game, that's how the show goes on. I
And
think,
yeah,
Aditya, a lot of people are asking with you and Manthan for some tips if you can help and some guidance. I think they would love that.
Like, first thing is like the way Manthan is answering questions is like as if he already know the questions or the questions got leaked. Like, before me completing the question, he's ready with the answer already. And two questions went wrong because of, like, let's blame audience and let's blame Manthan's friend for two questions. He lost 2,500 rupees, I guess. So yeah, like his answers are faster than light. That is faster than 3 into 10 power 8 meter per second. Yeah. So Manthan, like we have like first you tell us about your preparation strategy. Like how could you, reach a finale, the grand finale, and how could you answer questions amazingly? Because everyone is stunned looking at you, the way you're answering questions, the way you're connecting dots and arriving at the answer. Please, throw some light on. Matlab, please tell us your strategy, or if you can tell us about your strategy, about the way you prepare for your exams and all.
So for exams, for as of now, I think I believe in consistency more than the work. I mean, do 2 hours, but do every day 2 hours. So that is my mantra, kind of. I read every day. I mean, very
Okay.
less breaks.
So you give credits to your smart work or hard work? Which one do you think is helping you?
Sir, I think 75% hard work, 25% smart work.
Very
Because
well said. Very well said. Yeah. So yeah, 75% of hard work and 25% of smart work, right?
yes, sir.
Sure. Can you please give some tips to the audience? Actually, they are waiting for your wise words and your wisdom. Help them
Sir,
actually. They'll
I
also
just want to.
note these down, because these words are coming from an amazing person, from you. Chalo.
Sir, I just want to say, read every day, read multiple times. Like one of our teacher of anatomy used to tell us that revision is much important than vision. Like the number of times you go through and number of times it gets under your eyes, it makes a picture memory for me. Like I can imagine where it was written on my notes or my textbook, whatever.
Okay, and also I think this is very, on the spot. Like one quote from you to the audience, which you believe the most, matlab your favorite quotation.
Sir, consistency is the key, I think.
Okay,
I
simple,
think
but
I think I mean you can one thing you can never beat is consistency. I heard it somewhere.
true. You can always beat a smart guy, but you can never beat a hardworking guy. Yeah, true. And yeah, amazing work from you, and looking forward to meet you again in some other competition. And yeah, 8,750 is very less for you, for your wisdom, for your knowledge, for your medical skill. Me and the audience, we're all giving you 15,000 points tonight. Like, you deserve that. Chalo, great work again. And yeah, Computer G, you have anything to say?
Thank you so much, Dr. Aditya and Manthan. Dr. Manthan, thank you so much, Manthan. I guess we have your friends join in, and everyone is actually praising you, and they are totally saying that Manthan keeps on studying. And there is a person actually calling you that I have a crush on Manthan's brain. So you can see what you have done right now. We have funny moments. So kudos to you. Amazing. Like the way you were answering, the way your explanations were. And Dr. Aditya, kudos to you. Thank you so much for being such
Thank
a
you.
wonderful host tonight. Thank you so much for giving our audience such a clear, direction and guidance and everything, along with Manthan's explanation. What a coordination! Thank you so much for this.
Audience did a
Night.
great job as well today. Amazing job
Yeah,
from the
had an
audience as well.
amazing audience. Thank you so much,
Yeah.
audience. Before signing off, just wanted to say this was episode 2. We are going signing off. But wait, we have episode 3 tomorrow coming up. What will be there tomorrow? Who will be the finalist? Who will be the mentor? What you will learn tomorrow? Stay tuned for that. Dr. Aditya, Dr. Manthan, thank you so much once again for this episode 2, Clinic 2.0 grand finale. Signing off.
Thank you so much. Good luck, everyone. Thank you so much.
Thank you so much,
Thank you.
our lovely audience as well. Thank you so much, everyone, for joining in. See you tomorrow, episode 3.
Thank you.